I'm super excited to be joined today by a really good friend of mine and my personal dentist, Dr. Tony. And it's actually going to be our first video blog, Dr. Tony. So I'm excited to share this with the audience because you and I actually met for coffee a couple weeks ago, and we were talking about certain things, and I was talking about my lifestyle and longevity newsletter, and you were intrigued. And then I started talking about over 50, and you were throwing some stuff at me that was really intriguing. And I thought, whoa. And I even told you, slow down, stop. Let's save this for an actual interview. So that's why we're here today talking to Dr. Tony. Now, Dr. Tony, before we get started, I'd like you to give the audience your credentials, because I would be doing you an injustice if I tried to give your credentials. The list is so long, but give a brief list of your credentials and where you come from and what you've done in your career.
Thank you, Terry. I appreciate the time being here and look forward to it.
Yeah.
So I've been doing dentistry for over 25 years. Spent about 8 years in Midwest and about 25 years practicing in Scottsdale. Initially, the first 10 years heavily in clinical dentistry, and then I spent about close to a decade in academia as Associate Dean for Global Affairs, a lot of traveling, talking about oral health and systemic health, and finding ways to connect the dots for patients, and finding that there's a lot of common ground between our challenges here in North America and other countries as well. So it's been a nice journey. 25 years has been a lot of time. I have a lot of great to show for it, but
we all do.
It's been a blessing. It's been enjoyable to see dentistry grow and be part of that as well.
Well, and the great news is that we have someone like you within our area, because Dr. Tony just took over a practice in Corona Del Mar. So
Yes.
Talk a little bit about the practice that you have in Corona Del Mar before we get into the meat of the subject.
Sure. Just recently actually acquired a practice here from a doctor who's been practicing for a number of years, and a lot more than I have, and was time to retire. It was a blessing. Timing was great. And it's a great area. I love the Newport Beach, Corona Del Mar. How could you not like that? And so the idea of being involved with the community was really the big part. We have a youngster who is in 4th grade, and we're living in a community, and we want to be part of the community as well. So there's no better excuse to have a practice also in a CDM.
Yeah, hallelujah. And it's so nice again to have someone of your quality in the community that can share their wisdom with the patients and with consumers. So let's dig in, because I'm super excited to talk about this, because there's some stuff that I don't know. And as we know, this lifestyle and longevity newsletter that I'm producing is kind of a passion project of mine. And I want to get into the over 50 stuff. But before we get into the over 50 stuff, can we kind of take it back a notch and let's talk about the health issues regarding oral health and how it affects your overall body for every age group? Never mind someone over 50, but for all age groups. How does oral health affect the other parts of your body?
So oral health really is a gateway to your health. And when we talk about oral health and systemic health, they are intermixed, intertwined together. Regardless of the age, we see a lot of diseases manifest in the mouth, in oral cavity. But one of the biggest things is we're living longer, so we have to keep our teeth longer. Right? So we have one set of adult teeth, and typically by the age 12 to 14, we tend to have them all, except a few as your wisdom teeth, maybe.
Right.
So from that age on, 50, you mentioned the age 50, and that's just halfway through now. So you have to continue on with that. But systemic health and oral health is intertwined, and as we hear about it all the time, about cardiac health, also has to do with your stomach health, which is acid reflux, leading into other health issues, diabetes, just basically looking at health together and how the inflammation works in our system as a youngster or even as an adult. So it's a very important, and of course I'm biased obviously as a dentist, but it's shown that there's a tremendous amount of oral health issues that relates to our systemic health, especially while we keep our teeth, pretty much.
Right. Now, I have 2 young adult children. that I continue to push and try and get to the dentist as often as I possibly can and get them to the dentist. They're adults, so they can do their own thing. But how often should a younger person go to the dentist to stay on top of things? Like, how often should they be getting their cleanings, and how often should they be getting, their x-rays and so on?
So the recommendation from American Dental Association, typically standard, is twice a year. To visit your dentist twice a year, get your cleanings done. The idea of visiting your dentist is not to always have a treatment done, it's to prevent the problem. So getting sealants done, getting your cleanings done, getting your fluoride varnish done, and taking your x-rays are a big part of teenagers and above, because that's part of evaluating the overall health, right?
Right.
And so the importance of that, it's at least twice a year, and it has to be, mentioned a few times till it continues on.
Right. All right, so that's great. So let's get into the meat of this and what I think our audience, the over 50 crowd, is really looking for. And when we had this conversation having coffee, again, I stopped you because I wanted to kind of hear it like this. I wanted to hear it right out of the horse's mouth, right at the exact time that we were actually recording. So this is first take. I want to hear it. Over 50, what do people have to do to keep on top of their oral health, and what should they be cognizant of and careful of and be monitoring in their 50s and above?
50 is a good age.
Yes, it's
right?
a great age.
It's a breaking point,
That's
and
right.
a lot of wisdom comes with that.
Yes.
So we have to take actions, right?
Right.
Prevention is always a key when it comes to oral health. So the other day I had a patient who had just turned 50, and he was telling me, okay, I turned 50, and I want to take care of my teeth better. So my average or typical conversation goes as, number one, making sure you see your dentist a couple of times, hopefully me, continue to see me a couple of times a year, getting your cleanings done. X-rays will show bone quality, the bone health, which supports the teeth, is important. Having a night guard, which most of the patients still don't understand really the difference between a night guard versus a mouth guard, because that's not really explained properly most of the time.
Right.
But a night guard, a soft night guard, could be a preventive appliance to prevent problems, right? We clench.
Yes.
Naturally, we clench when we are under stress. And I think...
And that's a conversation that you and I have actually had in the past. So yes, I understand that, and that's very important. And I know I have to be more diligent in talking to you and getting ahead of that.
So night guard was the first passive preventive thing that I would recommend. And also, it has to do with the wear and tear of your teeth. So one of the perceptions about crowning a tooth typically is shaving a tooth down, and are we harming the tooth more than preserving it? Well, if there's fractures and there's cracks on the teeth, that actually is going to benefit the patient for long term. So at age 50, we want to look better, we want to look healthier, and so cosmetic work is typical conversation at our office usually, and conversation goes as about difference between a veneer and a crown as a longevity and health. So that's really based on the patient and wear and tear on your tooth structure. So that's something to do about your existing teeth. If you have crowding, which affects your way of cleaning your teeth, Invisalign has been around for a long time, or such as Invisalign. We do that at the office to move teeth to basically make it more easier for the patient to manage their oral health. 90% of managing their oral health in the sense of their gum health with brushing, flossing, and doing a water pick or using a mini brush is really part of your home care. It may take you an extra 30 seconds, but that's crucial in a big picture. So that's always a conversation that I have with our patient before we do anything, because it really requires the end game. After we do all the work, we do a full mouth reconstruction or rehab for someone who is ready to do that. The next step is, how are you going to care for that? How are you going to preserve all your investment and all the things that you've done? So from 50 to age 90, that's another 40 years that you got to preserve what you have. So prevention is a very, very important topic that we think everyone understands. They have to floss every day.
Right.
Well, does it happen every day? Not always. But there are tools other than flossing that does the action of cleaning between your teeth. So when it comes to cosmetics or implant dentistry, as we do with our patients, their oral health, the bacteria in the mouth, the systemic health are so connected together that the success rate depends on the patient's compliance and how well they follow up with what they do. So I usually tell my patients, please take care of my work. Please make sure you do the things that we talked about.
Right. So let's talk a little bit about gut health, because it seems like as I'm aging, my guts are becoming less stable as I age. And I'm taking different supplements and so on, so I can't narrow down what's causing it. But how does oral health and gut health connect? Like, what's the connection there?
So I will tackle on the acid reflux part of the gut health.
Okay.
Right. Acid reflux actually starts among newborn kids, pregnant moms, adults, and then obviously as we age. Why is that important? Because the acid that's in the stomach that moves up to an oral cavity does a lot of damage to your teeth over time.
Really?
So
okay,
that's one of the reasons that you see a lot of the teeth on the back of your teeth are worn out. In the front may appear to be okay, but when you see it in the mirror from the back of the tooth, and the erosion, which is the chemical reaction from the acidic environment, right? And so I oversaw a project that we launched at the dental school and university in Arizona, A.T. Still University, that it focused on measuring the pH of your saliva, the acidity, as a teaching tool to remind patients there's such a big dynamic change in your pH of your saliva. So as we eat, the saliva becomes acidic, and then we have a buffering capacity to kind of move it along, right? So that also evolves and changes over time because the supplements or the medication that we take over age 50 perhaps,
right.
High blood pressure maybe, high cholesterol maybe. There's over 1,000 medications that lead into dry mouth. And having dry mouth also adds on to the problem because now you have multiple things coming at your teeth and overall health. But going back to the acidic environment of having acid reflux, over 60 million people deal with acid reflux somehow and over-counter medication, which they typically during holidays with chocolate, with
right.
wine and different things lead into that possibly. So what we eat affects that. The time that we eat it affects that as well. So the gut health, the bacteria, as we age and we see those changes happening, is also the food we're consuming and how often we eat. Actually, we consume food affects the buffering capacity. So if we are healthy and we're exercising all the time and snacking is good, but then you got to make sure that you're removing a lot of that plaque, and so you're following through, so you're not getting a lot of cavities if you're not constantly making sure you're overseeing the sugar intake or carbohydrate intake and other things. So gut health is very important. I think it's overall health. In dentistry, the acid reflux or GERD is one of the pillars that we look for with the sleep apnea, right? Obesity, diabetes, high blood pressure, and GERD or acid reflux are the 4 pillars of a sleep apnea a lot of time, which is very important. So we help our patients to see a physician for that as well. So everything is somehow connected together, right? And that's the key is to be able to really emphasize on the importance and engage the patient and to really see what they have to do to maintain their oral health, because a big piece of their their everyday action, how they smile, this the mental health, the clenching that we do affects headaches, so depression, all those things really interact and correlate together, right? I mean, so when it comes to dentistry, how do we get from those things to teeth? Well, it is part of our process of how do we react to things as well.
Yeah, you know what? And man, you're giving such great information, and it's making me realize how little we think about our teeth, unfortunately, because we just take them for granted that they're there, they're going to do their job, and yeah, we go to the dentist once in a while, but we forget that these other things in our body are actually affecting our teeth. And as I'm sitting here listening to you about gut health and all that, I'm thinking the next person I need to interview for one of these is a nutritionist talking about gut health, or a doctor talking about gut health and what we can do to minimize that pressure we're putting on our teeth, or the acidity we're putting on our teeth, or the chemicals that we're creating. That's amazing stuff. Wow. You've opened my eyes. That's why I was excited to have Dr. Tony on today. He's not only a really good friend and an amazing human being, but you're so full of wisdom. If you are looking for a dentist, Dr. Tony in CDM, he's the guy to go to. Maybe you can now share with the audience where you are and how people can connect with you. So let's start with, how do they connect with you on social media? What's your social media connections?
CDM Dental, to keep it simple,
Nice.
on Instagram. And we are here in CDM, very close by.
Now, CDM, for those of you that are not familiar, that might be out of the area a little bit, Corona Del Mar, right?
Yes. Newport Beach, Corona Del Mar.
Beach.
And we're right off of PCH. And the phone number is 949-675-3131. And Dr. Tony at CDM is an easy way to remember. And please come and see us, and we'll look forward to helping you through the process and journey of life with oral health, the better oral health.
Yes. Now, before we go, I just got to do one more plug, because when we first met, it was a really cool experience. When we first met, we had a conversation in the parking area where you live, and you were kind enough, you didn't know who the heck I was, and he was kind enough to give me a couple of toothbrushes. Now, I'm going to tell you, I've been using an electric toothbrush for probably 12 years, and I love my electric toothbrush. I gave my wife one of the toothbrushes you gave me, and I used one of the toothbrushes you gave me. I have never brushed my teeth more using that toothbrush. And I know it's a silly little thing, but it actually encourages me to brush my teeth because I enjoy brushing my teeth. I've always had dentists tell me, you brush too hard, your gums are receding, blah, 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 and I'm like, yeah, whatever. Because I'm just, I hammer it.
Sure.
These toothbrushes are the softest, most comfortable, but effective. It's the craziest thing. And I know it sounds silly, but if you haven't, what is the tell us the name of the toothbrush.
It's funny you say that, because I love these toothbrushes, and I give it to all my family members. I give it to all our patients. And I got introduced to them while I was at the university, and we were talking about oral health and different initiatives. It's from Switzerland, and typically, I grew up with our typical P&G Crest,
That's right.
toothbrushes. And at first, when I was introduced to this toothbrush, it took me a couple of months to actually grab it and utilize it. I was actually overseas in Germany for a dental meeting, and I was there in a hotel room for five nights. I used the same toothbrush. And so the reason it's amazing is because it's super soft.
Yes.
And it's very, very gentle to your gums. And I don't own the company, but I think the company from Switzerland would love the fact that we are
that we're talking about
but
it.
That's because I actually have been using the same type of toothbrush. You got to change it every 3 months, by the way.
Yep.
Every 3 to 4 months, you got to change the toothbrush. Every time you get a cold, you got to change your toothbrush.
Oh,
right?
Okay.
So that's important. But it's called Curaprox from Curaden. They're in Lucerne, Switzerland, a beautiful city actually there. I visited them. It's a family-owned company for over 75 years, but they are colorful, and I like them, and I give it away to my patients because I personally use them. Now, electric toothbrush versus a manual toothbrush, it really has to do with the person. There is not one better than the other. Some people need to have electric toothbrush for dexterity reasons,
Right.
And also not being patient enough to brush their teeth.
Right.
The company does have also electric toothbrush as well.
Wow, really?
So, but that is a plug for them.
Great Christmas present.
I'm sure they'll send you some flowers as well for you.
I don't know. I don't think they'll see this video, but you know what? I had to plug that toothbrush because the exchange that we had and the generosity that you showed, and how much it actually affected my wife Jenny and I, and how much we enjoy it. It's just crazy. So I've never looked forward to brushing my teeth before, but I honestly do. It's not a plug, but I honestly do look forward to brushing my teeth.
Thank you, Terry.
I want to thank you so much for joining me today. I look forward to you engaging with maybe some of these people that are watching this video and them becoming patients. And hopefully we'll get you back on again sometime soon.
Thank you.
All right. Thank you, sir.
Appreciate it.
Thank you.
Take care.